Hello, I'm Dr. Denny Warren, and I want to welcome you to our office. See, my wife, Dr. Mandy Warren, and we opened up Generations Health and Wellness Center in January of 2006. And since then, we've been very fortunate to work with thousands of people and help them achieve a higher state of health and well-being. And we're excited that you have chosen us to be a part of your healthcare journey. I made this video for you so that you will understand the things that are going to be happening in the next couple of days. So that way you feel confident and comfortable coming into our office. See, the first appointment is all about the exam and getting to understand you and what you have going on and what your goals are. So on this email that we sent you, I want you to print out all the new patient exam forms and fill that out. That's actually going to save you a considerable amount of time when you come into our office. When you do come into the office, we're going to take you back and we're going to perform a physical exam to do any necessary tests so we can identify exactly what's going on with you. And we're also going to do a thorough history. In that history, we're going to need to know any traumas that you had, any sports injuries that you had, anytime as a kid that you've fallen off your bike. And we even go way back into childhood because oftentimes we'll have parents come into our office that have an area in their neck or an area in their back that's bothering them. And then we find out and we discover that there's actually arthritis and degeneration in that area of their spine. And see, what's interesting is they can remember, oftentimes they can remember the incident or the trauma that they had when they were a child, that their back or their neck has never been the same since then. And so now over years and years of that area being misaligned and not moving properly, they've actually caused degeneration arthritis. And I think that's the number one reason why we also see a lot of kids in our practice, because the parents see their children having the same things happening. So we're going to do a thorough history asking about any of those traumas. We also like to take posture pictures of our patients. This is pictures of looking at your posture where you're not exaggerating good posture, you're not exaggerating really bad posture. You're staying in a position that you feel is natural and normal to you. And there's oftentimes we can tell exactly where you're holding stress in your body just by evaluating your posture. And for most of our patients, we're also going to take x-rays. Now, of course, if you're pregnant, and for a lot of our pediatric patients as well, we don't take x-rays. But for most of our patients, we do take x-rays because that tells us exactly where the problem area is. Once we get all of that information in that first day, we're actually going to schedule a second appointment. This second appointment is what I call the report of findings. It's a report where I'm going to sit down with you one-on-one, or if you want your spouse to come, that's a perfect time for them to come. So I can sit down and go over with you guys exactly what we found in the exam findings, exactly what we found in the x-rays. And if I feel like we can help you with what you have going on and help you reach your goal, then I'm going to let you know that at that time. And then we'll also talk about the most appropriate care plan for you. And also at that time, that's when we talk about all the financials as far as a care plan is concerned. Whether that be a prepayment, whether it be monthly payments, whether it be paying visit by visit, whatever that might be, and whatever that might look like for you, we're going to figure out the best option for you. And we'll talk about all insurance coverage as well. So I want you on the very first visit, when you come in, bring your insurance card so that we can make a copy of that. And in the second visit, we'll go over what that means as far as insurance and payment in our office is concerned. So I hope this helps you. Again, I want to welcome you to our office. I want to thank you. If you're coming in because of referral to our office, which most of our patients are, please, if you could, tell them thank you for us, because the next time that we see them, we'll do the same. So again, thank you for watching this. I look forward to meeting you very soon. Have a great day.